The training program was really built, mindfulness and compassion skills are the basis that we build for people to enter into greater self-awareness and beginning to embed skills and training that people could sustain themselves and also skills that allow them to be more at ease in their lives in general. It became clear to us that these skills that we were doing for end-of-life practitioners and people, hospice, palliative care doctors, nurses, chaplains, social workers, the whole body of the team, that suddenly as we went to Sick Kids Hospital, now we had radiologists and pharmacists, and we started having people come from the whole hospital community into the training program. And it was a really important part of our development.
Well, being with death and dying, trauma, loss, grief, and bereavement every day in the work that I do takes a toll on me. It takes a toll on the caregiving that I can provide for the people that I serve. And I want to provide the highest quality of service for those individuals. So I have to take care of myself. And to take care of myself, I have to address things such as moral injury and empathetic distress and burnout. And the program provided all the tools and skills and knowledge to address those aspects of our care.
You know, this course is very meaningful for me because several years ago, I was so disillusioned with the healthcare system that I was actually thinking of quitting medicine altogether. And having done this program allowed me to really take a backward step and look at, what is my purpose and meaning in life and how I can, do further training outside of medicine so that I can serve healthcare professionals better in a way that is much more relevant to them.
The program started as a program to support people who are working with people in end-of-life care, and over the years has expanded to include all healthcare professionals or volunteers or even some people who have just been touched by death and dying in their life. And I think the core principles of the program are to teach the skills of mindfulness and compassion, to build sustainability for people who are doing the work, to reduce burnout, build resilience. But I think the secret hidden agenda also inside of the program is that it's really transformational in terms of turning people toward deep internal experiences.
The certificate program, builds on the development of a whole process of skill building. So you build, first of all, presence is the first skill of the training, and that's what mindfulness training develops, is this capacity to be in the present moment, the capacity to be with what's not known, and then the capacity then from that place to act in a loving place. And then the second part of the program develops the compassion-based skills. So you learn the skill of how to turn towards your own suffering first. And then from that basis, it's an embodied awareness of your own suffering. Then you're in a position to better understand others. And then we move towards what we call the compassionate communication. How do I take mindfulness into my relationships? How do I take it home to my kids? How do I bring it to my family? And particularly, how do I bring it to my patients? How do I bring it to the settings where my coworkers are also suffering? And finally, we do the last module focuses on how do we bring mindfulness and compassion into the systems that we work in. What skills are needed? And we approach something called systems thinking. It's the final part of the training program so that people walk away with skills of how to bring it into their organizations.
The other thing that I think is really powerful about the program is that it's actually deeply grounded in contemporary neuroscience and neuroscientific understandings of mindfulness and compassion, and is also grounded in a bunch of other very evidence-based, very real-world, walks through a stepwise learning process.
So neuroscience is actually very close to my heart, and I think one of the unique features of this course is that at each module, I will actually go over the latest research in neuroscience and look at how, the underlying mechanisms of how mindfulness and compassion can change our life, and also the benefits of mindfulness and compassion from how it actually rewire the brain and allow us to, better adapt to our environment.
There's a whole range of scientific research that's out right now, and there's increasing research being done in the neuroscientific community and the social psychology fields about the impacts of mindfulness and compassion. Mindfulness actually creates a sense of well-being. It drives us towards inner awareness where there's greater acceptance. And this is one of the psychological benefits of mindfulness practice. We call it emotion regulation. So as you learn how to slow your mind down, one of the first practices we teach people is called pause. It means pay attention, use sensory awareness, which is what mindfulness is training us to do.
I think that the program is a real opportunity to take time for oneself in a really deep, systematic, supported, spacious way.
What it has done for me now is that I can spot it at opportunities where I can be more mindful, or is necessary to pause and consider other people's perspectives.
There's one thing to be able to be self-compassionate and present in your work, but if you can't take that sense of compassion home, if the work infuses you, hurts you, traumatizes you, what do you think you're taking home with you? So what it's actually done is helped me to be a better father, a better parent, a better partner, and if I may say, maybe a better member of society, right?
And another important feature of this course, which I don't think any other course offer, is also to look at this from a system perspective, because there are many system factors that are crucial and have a more skillful way to handle them before we can really promote our health well-being so that we can be truly of service to whoever we want to serve.
I believe that it's an important program because as a psychotherapist, I'm really committed to the work of change and transformation in people's lives. As a contemplatively based program, where we're teaching people skills to be present to their own experience so that they can be present to other people, that we are transforming the way that the work happens in healthcare, but we're also transforming what it means to be a person out in the world, how we bring ourselves into our families and communities, evolving all of us into being kinder, more present, more connected people in the world.
I think this program is a career changer for anyone working in healthcare and anyone working in end-of-life care, because it really gives you the opportunity to be with a community of people that are interested in having the best inner skills that they can to sustain themselves, and to feel more resilient, I guess is our popular word today for it, is that you feel more alive and more connected to yourself as you go back to do the work you're doing.